Welcome to Like, Love, Share by Babblebox, the show where marketers and creators go behind the post to unpack what actually drives attention, trust, and impact on social. We spotlight smart growth hacks, breakout campaigns, and real-world influencer case studies from emerging brands to cultural moments you might have missed. Whether you're building a brand, growing a platform, or shaping what's next in influencer marketing, Like, Love, Share is your source for ideas worth spreading. If you care about reach, relevance, and results, you're in the right place. Let's get into it. Hi, everyone. I am so excited. We are going to talk about some crazy stuff today, and I'm here with Missy Voronyak.
Yes. Hi, Sherry.
Welcome to the show. Thanks for being part of it.
Yes, thank you. I'm so excited. I'm a huge fan of Battlebox and you and your team, and so it's really exciting to be here. Thanks.
Thank you. And if you want to introduce yourself a little bit, it's Voronyak, and you have a
Yes,
specialty agency that focuses on healthcare, pharma, influencer marketing.
correct. Yep. And my background is a little unusual because I did start as an influencer like many, many moons ago. I don't know if you even know that, but I was a parenting influencer and I loved it. It was back when blogging was cool and innovative in like the early days. I had free LASIK eye surgery. I got free tickets to Disney World. Like I did all these cool things. I pitched Macy's to do a bra fitting event with me for my audience, and they were like, "Sure." And I was like,
It
"Hey,
was crazy
cool."
days. I was in that
Right.
world too.
So fun. So I had that experience. Meanwhile, professionally, I was in healthcare marketing and I loved working with hospitals and clinics to help them reach patients. And then I didn't do anything on the brand side for influencer. And then I was recruited to go to agency life. And this agency was called Real Chemistry. I was doing healthcare marketing for hospitals and clinics, and I wasn't doing anything for influencers. So they were two totally different parts
Oh,
of
and
my
did back
life.
then.
Then I started doing healthcare marketing for pharma, and the team realized that I had influencer background, and all of a sudden my worlds collided. So pharma clients were just starting to pay attention to bloggers, and they were asking, how can we get in front of bloggers? Can we do an influencer summit? And that suddenly my whole life changed, and that became my focus. So 10 plus years later, that's all I do. That's all I focus in. And I started my own company to focus on it.
So I'm going to go back because I think that's when I met you.
Okay. Yes.
Met you.
Yes.
I don't know where. I remember coming to a room and there was a lot of people in a little room.
Yes.
I remember specifically, and I started too as a blogger. And I realized very quickly that I wasn't getting anywhere like you. So I started saying, well, what can I do here? And that's how this turned into this.
Yes.
But I guess my next question is, because I then remember a conversation where you're like, I don't know, should I start an agency? And I remember having a conversation. So now you have your own agency, and you
Yes.
tell us what that feels like.
Okay. Well, first of all, you were so helpful to me
Oh,
and so generous with helping me with like thinking through that piece and offering to help me with contacts and ideas on marketing. So I'm so grateful. Thank you.
of course.
I think it's really important for women to support each other and to, help boost each other up. And so I'm now doing that as much as I can as well, now that I'm an entrepreneur and helping other people who are starting. So I love having my own business. I love, love, love being my own boss, sleeping in until whenever I want to, not needing to ask anyone permission to take a doctor's appointment, like just having complete control over my life and my schedule and deciding which clients I want to work with and saying no to the ones that I don't is a type of autonomy that I never had before in agency life. So it's really great. I also get to, do all of the things like branding and ordering merch and, choosing cool partners to work with. So it's really fun. I really love it.
So when you talk about your agency, tell us a little bit, like give us like not a day in a life, because I don't want to be cliche, but like what is
Okay.
it like what are you working on? What's the specialty? Yeah.
Yeah. Okay. So I have some clients who are pharma and some who are med device, and they're very similar in the types of like rules that they have around marketing promotional products for drugs or medical devices. One example is a medical device company has hired me to help them plan and host influencer summits for physicians who happen to be interventional cardiologists. So they're very, very, very smart people And they are already active on social media. And so the company wants to learn from them, ask them what's important to you on social media, what channels do you use, and then get their input on the type of marketing that the company is doing on social media. So my role in that is to help them plan a meaningful event, a full day summit, and then actually facilitate it. So when they brought me on last year, they flew me to Amsterdam and we hosted an event for European cardiologists. And then just last month, we had our second one for US cardiologists, and we're planning another one for later this year. So that's one example. More traditional influencer marketing with sponsored content. I am working with a pharma company who is doing a disease education campaign. So I'm not going to get into too much details because it's still in the planning phase.
Yeah.
But imagine there's a disease that not a lot of people know about. How can we educate the community about it? And so partnering with them on some events that they're hosting and finding influencers to go to those events around the country and basically educate their audiences about what they learn at that event.
I saw a post that you probably did, I don't know if it was a day ago or 3 weeks ago, because LinkedIn is resurfacing content.
Right. Yes.
About people think you could just go to a cardiologist and they're going to take 500, whatever, pay
Yes.
$1,000. But when it comes to this category, if you're,
Mhm.
any profession, doctor, accountant, anything that's highly regulated they're not necessarily open to doing something. So tell us about that, because that's the reality.
Right. Yeah. Just because somebody is an influencer doesn't mean they're for sale, first of all. Right. And so when you think about those types of people that you mentioned, they have very high standards around the types of partnerships that they will take. And sometimes their employers have rules about it. Like if you're a physician who works in a university system, you may not be able to do any brand deals, or only ones that are unbranded, meaning not for a specific product like a medication, but you could do disease education. Some of them will be willing to do things like Pampers and things that are good for families, but not medications or disease awareness working for pharma at all. So my role when I'm recommending doctors for a physician campaign or any healthcare professional is I always try to get a really high conversion rate on people we ask. So if I ask 5 influencers, I want all 5 to say yes, because I want to have such a good idea that they're a right fit and that they will say yes. So I look at where do they work? What kind of partnerships have they done in the past? I look up what's called the CMS open payment system. I look up, have these physicians taken money from pharma before? And what was it for? I scour everything I can find to see, does it look like they would do this? So that the chances are it would be a good fit and they're more likely to say yes when we go to them. If those signals don't look good, I'm never going to recommend them to my client.
Which is amazing, because I think people think, oh, it's so easy, we're going to go do an influencer campaign. But I could tell you, for every campaign, there are these criteria that no one even thinks about. Well,
Yeah.
go to these 10 cardiologists, not that easy. The other question I'm going to have, because you said a lot about events, and I think, there was a myriad of things that happened during COVID, but events are so powerful. And I would love to see more. Yeah, there's the big ones like Coachella, but they don't have to be that crazy. And I would love for you to talk about like this whole event front.
Yeah. So events are certainly they take more time, planning, budget, energy. And so not all brands, let alone in healthcare, are willing to like really dedicate to making events take place. I see a lot more of the summits of bringing influencers in to learn from them and get their feedback. Those are still happening pretty regularly and back to in person post COVID. These like disease awareness events that I just mentioned, I'm just starting to see those kicking off again. The other type that I've seen is, but I haven't been working on, are a pharma company bringing together like a press type event where they invite regular journalists. Yeah. And then they have on the stage patient influencers, physician influencers, a scientist from their company to talk about the latest in the
Then they're covering PR and all things. Like you can invite that, I think is so cool.
Yeah, so that's a neat approach. But yeah, this disease education event tour this summer. I'm really looking forward to it because it's not meant for influencers, it's meant for the general public, but we're inviting influencers to be a part of it and to cover it and partner with them as paid, paid promotions with their content.
And also that what I think they help with too is like the pre-event promotion, the on-site promotion, because a lot of the other attendees might not be that, social
Absolutely.
savvy. Yeah.
Right. So the importance here is to get local influencers on the ground in that region so that they can help drive attendance.
Yeah.
Yeah.
Amazing. There's a lot of different, like you talked about a certain type of creator in this space, but there's different buckets of creators in this space. Which do you think, can you just highlight high level, like there's the doctors, there's the caregivers, like where do you think, because I think a lot of companies don't know what those options are, in the creator world. And then where do you think the growth is? Like, who do you think is making the most impact or underutilized?
Right. So you just mentioned two of them. The physicians and caretakers are both really important patient advocates. And sometimes that's all they talk about is one particular disease area. So think of someone who has chronic migraine and all of their content is about migraine and helping other people to cope with this serious chronic illness. But then there's lifestyle influencers who might talk about parenting, fashion, travel, but they occasionally mention that they have migraine. Those are great partners as well because you're going to get a totally different type of content vibe from them. You're going to get building trust with a totally different general population of followers that they have. The other thing I would add is with caregivers, sometimes again, they talk about it all the time. Like it could be a parent of someone with cystic fibrosis. And so they're talking about that whole journey of like raising this child with cystic fibrosis and different treatments that are out there and going to the hospital. But then there's going to be people who maybe it's a beauty influencer on YouTube who is all about makeup, but she has cystic fibrosis, right? So what would that look like to enter the culture of her YouTube channel talking about makeup, but to also be able to weave in some disease education? If she's open to that, that's an amazing, cool partnership that's more culture driven versus like patient story, patient focused where that's their whole world.
And I feel like one's the authority and one's more of they break it down so the average person can understand it. And that's me. That was kind of like, I remember back in the blog, there were so many moms who started their blogs about allergies. Their kids had food allergies.
Yeah, that was me, right? So that was mine.
That was oh, I didn't even know that.
Yeah, that was mine. So I started as general parenting, but then when my child turned one, he was diagnosed with a myriad of food allergies, egg, peanut, tree nuts, soy, milk, like it was a long list. And so then I started writing about that. So it was like, from like general breastfeeding and going back to work to like food allergies. And that is when I started to pick up a lot of traffic on my blog and became known as like a parent expert on that. And that is when pharma started coming to me because EpiPens were the only treatment on the market for food allergies back then. And so they flew me around the country and paid to sponsor content and brought me to Disneyland in California to show us like how they did menus for food allergies and that they had EpiPens in the first aid stations. So that's where I started to learn like what is it like to be an influencer when pharma comes to you. And that gives me amazing insight still today when I'm counseling clients and their MLR teams, medical, legal, and regulatory, on how we need to engage with patient influencers.
So interesting and so smart. I didn't even know that that's how you got started.
Oh my gosh, yeah. I'm still very involved in the food allergy community. There's a handful of advocacy groups, but one is called FACT, Food Allergy and Anaphylaxis Connection Team. And they started hosting an allergy summit for influencers and advocates a few years ago. And so I was a speaker at the first two. And then last year I encouraged them to like invite some physician influencers. So you may know who Dr. Rubin is, the hula hooping allergist. So he came and he was a speaker and everyone was like gaga for him. And I got to introduce him. And so we had a handful of really cool like physician influencers that were there. Yeah. And now we're planning one for this year too.
Okay. Keep me posted on that.
Yeah, it's in November in Chicago, or maybe October. I think it's October in Chicago area. And it's open to everyone. You don't have to be an influencer. You can just be, a parent or a person with food allergies or a clinician, HCP. The other area we could talk more about is with those physician influencers. There's some that are like really academic. They're posting more on Twitter and LinkedIn. And then there's some that are more like B2C that are doing consumer education. And those are the ones that I think we get really hyped up about because they know how to create content that's interesting to patients, the general public. And that really took off during COVID. That's when we saw doctors with a little extra time on their hands who were really
Dermatologists and all
out
those.
there. Yes. And many of them wanted to combat all of the misinformation about vaccines and what was happening with COVID. And then they continued to grow their platforms. Yeah, I've been seeing a lot of physicians really growing that way. And that's where you asked a question about where is there room for growth within the different audiences of creators. Physicians for B2C, direct to consumer, that is where I'm seeing the most growth with pharma companies right now, and some with med
Because they're more relatable. But I will say this. So to me, in my head, when I think of the LinkedIn and the Twitter people, I call them subject matter experts almost, because they're likely not going to do pay for play. They're not open to that a lot of the time. And they're just smarter than me. Like, you know what I mean? It's just, so I almost put them in a league like they're subject matter experts.
But I'm sure you've seen that like there are now influencers on LinkedIn who are doing paid posts. Like, isn't that interesting? And I have done a couple of partnerships with physicians promoting B2B, so to other physicians about medications on LinkedIn. So we call it, it's the LinkedIn thought leader ads, where the physician can post on their own channel and then it can be boosted by the company as a paid ad out to a broader audience. So one example that I did was in psychiatry. There was a new treatment coming out for schizophrenia, and it was like a really big deal. There hadn't been a new treatment in a really long time. And so there were two physicians that were already familiar with the company. They were KOLs, key opinion leaders, the really smart people who always talk to other doctors, not to audiences, general consumer audiences. And I coached them through how to film themselves, in their office and make a video and, get the script, everything pre-approved. And then they posted it on their LinkedIn and then we boosted it. And LinkedIn actually turned it into a case study because it was the first time pharma had done a brand partnership, like for an actual medication targeting other doctors on LinkedIn.
Amazing.
And so that is where things are starting to move, is like actually leveraging those physicians for B2B in addition to B2B.
Yeah, it's amazing. That's a big win.
It's huge and it's not easy, right? It takes a long time. There's a lot of planning. There's a lot of risk involved. And so that's why companies like that need someone like me who's very focused on FTC, FDA, and understands how to navigate.
All right, that's my next question.
Okay.
When you deal with pharma, because we do some of them, I'm no expert like you, but we do them. There is a lot of review and approval, and like even down to the second of where the disclaimer has to be on the video. You say you love that? Like, tell us a little bit more about it, because it's a lot.
Well, it is a lot. And I remember learning, like, how does a drug go from an idea to becoming approved in the FDA and go out commercially? Like, that is just the basic part to learn, is like, how does that happen so that you can understand where a drug is at in its journey and what the concerns are from the medical, legal, and regulatory teams. It's kind of like, how does a bill become a law? There was like a song about that growing up. So understanding that piece is important. And then trying to understand what are the concerns that they have. And the biggest one is always, anytime you're doing marketing with pharma for a medication, that patients know the risks. They need to not only know the risks, but it needs to be as much risk information as the benefits that you're promoting. So if you're saying Botox can prevent wrinkles, I've never worked on Botox before, but I'm
all the other things,
right? If you say 5 good things about Botox and it takes you 30 seconds to say those things, you need to have at least 5 risks and at least 30 seconds of risk information to have what they call fair balance of the benefits and the risk. So usually what that looks like is a creator is talking and saying all these great things about Botox and how it fits into their life. And on the bottom of the screen, it's saying, here's some risk information about it. And then you hear the influencer's voice start reading, just like you see on TV, don't take Botox if you're allergic to
My
Botox.
son knows all the commercials and he's 14. He does all the songs and and if this is you, you're gonna risk this. And he sits there and he parrots all of them.
I love that.
Yeah.
Yeah, there's been a few Saturday Night Live skits about it as
Yeah.
well. I think that the reason I like it is because I've just done it for so long that I get it. And I'm also really good at finding examples of people who have done it well and using that to help those MLR teams and pharma understand here's how they did it and they didn't get in trouble, and this looks like a great example of a gold standard that we could do. And then they start to feel more comfortable that they're not the only one, and here's, we can see some examples from other companies.
So interesting. It's a lot because you're going through a lot of reviews, a lot of revisions, and it's down to every single word and yeah, so kudos to you for doing that as a full-time.
Thank you. Some agencies get stuck and never get through the process and get content to market, and everyone blames the MLR team. They're being too strict. They're holding us back. But my challenge is always to get it done. That's what they hired me for. I know we can do this. Let's find the yes. And let's partner with those MLR teams and build trust with them so we can get to yes and get it into market. So sometimes clients will hire me because their other agency is stuck and they know that I can get in there and help them with it.
That's amazing. Yeah. So in terms of that, where do you see healthcare influence marketing going? Are there trends? Are there pockets that you think need to have, places that things need to move, or what do you think is next?
Well, we talked a little bit about more opportunity with physicians. So I think that is definitely key to where we're moving. So many more physicians are growing as influencers. There's a group that I adore because I study physician influencers, right? So I get really excited about it. There's a physician named Olivia Richmond who is building out a group of physician influencers called Docfluencer MD.
Awesome.
And they are not out to make money from industry. They're out to educate the public. And every month they take 2 topics. So every 2 weeks they have a topic, and those who are interested opt in to create their own post about it. So think about measles outbreaks, or one really impactful one that they did was about pain management for women getting IUDs and how it's so important, but so many people are just told to take Tylenol, and how to advocate for yourself. Right. So they choose these topics, and then instead of one doctor reaching 1 million people, they've got 10 to 20 doctors who have millions of followers, and they all talk about it at the same time, and they can really make a difference in public health. So how can brands, if I'm a pharma brand, I want to think about how can I tap into that group? How can I learn from what they're doing? How can I support them or sponsor them? So those are the kinds of things that we should be thinking about, is where are the influencers going, and how can we look to be a part of that? Also think about, where is marketing going as a whole? Where is consumer marketing going? You look at how influencers are now getting Netflix deals, streaming shows, right? So that's interesting. How could pharma be a part of that? Is there a streaming show about a disease area with a bunch of patient influencers? I'm just making this up.
What about if those 20 doctors are on a show?
Right. Yes. So thinking about how can we go where culture is going, and how can we embrace that and be a part of it? It might take 10 to 20 years longer for pharma to arrive, but that's where we try to think ahead and try and follow those trends.
Yeah. This has been so helpful. I'm so happy to see all your success. I watch you on LinkedIn and I'm like, this is amazing, and keep it up, keep it going. I'm going to end with my final question, which you can answer. You don't have to answer. Name an influencer you love to follow, but hate to admit that you do.
Did you ever watch Little House on the Prairie growing up? Do you remember Nellie Olson?
I don't know. The Littlest? I don't know.
Nellie Olson was the snotty little brat whose parents owned the Olson Mercantile. She had the the ringlets, and she was the little brat that was always making everyone's lives horrible. Little Nellie Olson, the actress is Allison Ingram, and she has grown up into this amazing badass woman who still embodies some of that bitch mentality that Nellie Olson had on the show. And so I follow her and I'm actually reading her book right now.
Oh my God.
It's something like The Bitch of the Prairie or something like that. It has the it has the swear word
So
in it.
funny.
Or The Prairie Bitch is Back or something like that. It's about her life. Her parents were celebrities, actors, and she grew up with like this amazing life story. And then I'm just now getting into the part of like what it was like being on set and Michael Landon and like the whole thing. So it's really fun watching her online and then reading her life story. And then the embarrassing part is that I'm like rewatching all of the Little House episodes. It's
I
on Peacock.
It is. I watched them when I was a kid, but I don't remember. I was like, I mean, I always just felt like I was like watching like a Canadian, show because I was in Canada. Like, oh, this relates to me.
Well, I grew up in Minnesota and the show is like set in Minnesota. That's where
Right.
the author Laura Ingalls Wilder was, that's where her story took place, even though they filmed someplace else. So yeah, that's my like kind of embarrassing like throwback to Little House on the Prairie.
It's like me with Blair from Facts of Life.
Ooh, yeah.
Where is she? What is she doing? So I started following her because all of a sudden she was showing up in my feed, and there's my
Oh
similar.
my gosh. I love that. I
Yeah,
bet she's written a book too.
I think she's coming out with a book.
Yes. Fun.
Yeah. Well, thank you so much for everything. And how can everyone find you if they want to find you?
The best way is on LinkedIn. So look for Missy V. I'm probably the only Missy V out there, Missy Voronyak. And then, of course, I have the website and all those things. But LinkedIn is the quickest way to connect with me. And then we can stay in touch there.
Awesome. Thank you.
Thank you, Sherry.